Infant crying and soothing. What you need to know to keep your baby safe. If you are a parent, expecting parent, foster parent, or a family daycare provider, nanny, babysitter, or other person caring for an infant or young child, this presentation is meant for you. Babies are a great joy to their parents and to those who care for them. Sometimes, though, their crying can be challenging. While parents usually learn a lot about infant feeding, bathing, and diapering, they don't always learn about infant crying, how to soothe infants, and what to do when soothing doesn't always work. Here are some important things for you to know that will help you better understand and care for your baby. First, crying can be the most difficult part of taking care of a baby, particularly when infants are difficult to soothe. Crying is a baby's way of communicating his or her needs. Importantly, babies do not cry to make their parents angry or frustrated. Crying, even a lot of crying, can be normal. Bouts of 35 to 40 minutes, totaling 2 to 3 hours a day, can occur with some babies. You should know that infant crying typically begins to increase at 2 weeks of age, peaks at around 2 months, and then starts to gradually decrease after that. Your baby's crying may be different, but it's good to know that if and when his or her crying increases, you'll know it's normal and can get extra support around that time. Crying can happen for no obvious reason and can be unpredictable. Some babies seem to cry more during certain times of the day, such as late afternoon or early evening. Crying can be irritating and very stressful, especially when infants are difficult to soothe. Some infant crying appears to be inconsolable, particularly around the peak crying period. This time can be especially hard for parents and caregivers. Infant soothing techniques and support from family and friends can be very helpful for you and your baby at this time. Here are some questions to consider when your baby is crying and needs to be comforted. Does your baby's diaper need changing? A fussy baby might cry more during the changing, but usually he or she will calm down once they are dry and more comfortable. Does your baby seem too warm or cold to the touch? If too warm, remove some blankets and loosen clothing. If cold, adding a blanket and some socks will help. Does your baby need to be fed? Some babies who are fed on demand cry less, especially during the day, than babies who are fed on a 4-hour schedule. Sometimes babies may need just a little extra milk or formula to make them settle down. Try burping your baby too. If you think your baby might be ill, call your pediatrician or health clinic and get advice. Sometimes, though, your baby may be crying or fussy because he or she just needs to feel close to you. Here are some soothing techniques to try that may help your baby soothe easier and cry less. Try carrying your baby in your arms frequently, or wearing your baby upright against you in a cloth sling or baby holder. Babies respond well to the constant closeness and movement. If you're able, try feeding your baby on demand. This will lessen your baby's crying too, especially during the day. Try holding your baby's bare skin against your own. You might find he or she is comforted by the warm, close contact. Respond promptly to your baby when he cries or fusses, and be sure to give him lots of attention when he's alert and happy. Babies benefit from all this attention. It won't ever spoil them, and it may just reduce some of the crying. You should remember, though, that sometimes babies will just need to cry no matter what you do. Try to relax about it, and remember, it's normal and it won't last forever. Many parents report that their babies are comforted by these additional soothing tips promoted by pediatrician Dr. Harvey Karp. Here is a summary of the 5 S's that you might want to learn more about and try. Swaddling. Wrap your fussy baby snugly in a light blanket. But don't overheat your baby or put him to sleep with loose blankets that could wrap around the face. Side or stomach position. When your baby is fussy, you might find that she calms faster if you hold her in your arms, on her stomach, or in a side position. If you are putting her to sleep in her crib, however, remember to put your baby down to sleep on her back only. This has been found to reduce the incidence of sudden infant death syndrome, or SIDS. Shushing. This is magic for some babies. Make a loud shushing sound, louder than the baby's crying, or turn on a hair dryer safely away from the baby. Some babies will be comforted by this noise, and the crying may stop. You can also buy a CD of these white noise sounds to play for your fussy baby or to help him sleep. Swinging. Babies love motion, like rocking chairs and going for walks. Again, try wearing your baby upright in a cloth sling or baby holder. When your little one gets upset, hold her close, support her head, and try a little dancing. Fussy babies love tiny, jiggly movements. The last of the 5 S's is sucking. Offer your crying or fussy baby your breast, finger, or a pacifier. To learn more about the benefits of these infant soothing tips, visit Dr. Karp on the web at thehappiestbaby.com. Sometimes, without thinking, a frustrated or angry caregiver can shake a baby in an effort to make them stop crying. This shaking can be a pattern of abuse or a one-time event. Usually, the caretaker is alone with the infant and simply loses their patience and then their temper because they can't stop the infant from crying or being fussy. The sad fact is that infants who are shaken will likely stop crying, but this is because their brains have been damaged by this violent action. Sometimes, when a child is shaken, injuries are internal and there are no outward signs. When shaking has been severe, though, injuries can occur to the brain, eyes, and bones. Because infants are held tightly during a shaking incident, bruises on the arms, chest, and back can sometimes also be found. Injuries to the brain occur when a baby's head is forced to move rapidly again and again in back and forth, side to side, and circular motions. When this happens, the soft brain strikes against the hard skull, causing fragile blood vessels in the brain to tear and bleed. Pressure builds and the brain swells, preventing cells from getting the oxygen and nutrients they need. It is this combination of pressure in the brain, lack of oxygen to brain tissues, and swelling that is often responsible for death among shaken infants. There are reasons why babies are so vulnerable to this type of handling. First, at birth, an infant's head is large and heavy in proportion to its body. Neck muscles are weak and poorly developed, so infants can't control their head movements. Also, an infant's brain has a high water content, making it soft, jelly-like, and very vulnerable to damage during a shaking episode. Signs and symptoms of shaking that parents and caregivers should be aware of can range from mild-appearing ones, such as vomiting without diarrhea or fever, irritability, lethargy, poor feeding, to more serious symptoms including difficulty breathing, cold body temperature, seizures, and coma. If you suspect that your child has been shaken, take him or her immediately to the hospital and tell the doctor about your concerns. As we can see from this picture of a shaken baby in intensive care, the outcome for children who are shaken is generally poor. Sadly, a fourth to a third of victims will die. Of those who survive, the majority will have significant and permanent handicaps, including brain damage, impaired use of their arms and legs or paralysis, seizures, vision problems or blindness, and hearing loss. Mental retardation and delays in physical and intellectual development can range from mild to severe. 1/3 of survivors appear to have no apparent effects from shaking. Long-term follow-up, however, shows that 1 out of 4 victims who were initially symptom-free were diagnosed with learning disabilities or other delays after they reached school age. While many men are nurturing and are wonderful fathers and caregivers, sometimes lack of experience caring for young babies or coping with infant crying can lead to tragic results. Reported cases of shaking show that fathers are responsible for half of these incidents. When mothers' boyfriends are added, we find that males are responsible for over 2/3 of cases. Daycare providers and babysitters account for 17% and mothers for 12%. While the ages of these individuals vary, men in their late teens and early 20s are most frequently identified in cases of shaken baby syndrome. While shaking an infant can never be justified, reasons that may trigger the behavior include lack of experience in caring for crying, fussy babies, and a lack of knowledge about how infants develop. This lack of knowledge may lead some caregivers to feel that an infant's crying is on purpose and that the baby is criticizing their parenting or caregiving abilities. They don't understand that crying, even a lot of it, is a normal part of a baby's development. Life stresses may also play a role in shaken baby cases. These might stem from a difficult pregnancy or birth, lack of support from family and friends, or postpartum depression. Fatigue caused by lack of sleep, which all parents of young infants experience, is known to contribute to a lower tolerance for frustration and anger, and it's a main factor in postpartum depression and nursing failure. Other factors that might contribute to shaking include difficulty with anger control or a history of violent behavior, and unstable family situations such as marital stress, divorce, or financial problems. Alcohol or drug abuse and mental health problems have also been found to increase the risk of non-accidental injuries in children. As we have learned, sometimes babies will cry no matter what a parent or caregiver does. It doesn't mean you're a bad parent or not good at soothing your infant. It just means that sometimes some babies just need to cry, and that's normal. If crying is beginning to get to you, or you are frustrated or angry for any reason, an argument with your partner, job stresses, money problems, it's okay to step away right away and calm down. Take a few deep breaths and gently place the infant on his or her back in the crib. Go to another room away from the crying. Remember that no infant has ever died from crying, but babies do die from shaking and slamming injuries caused by angry adults who didn't know it was okay to step away. Sit or lie down, close your eyes, relax, do some deep breathing, listen to music, take a shower, get a snack. Imagine yourself doing something you really like to do. Call a friend or relative and talk about what's going on. See if someone can come by for a while. Check the baby every 15 minutes or so, but only if you're calm. You can call your child's doctor or health clinic for advice if you think the baby might be ill. You can also call a parent stress line or family support service and talk to someone about how you're feeling. Trained and caring staff are waiting to give you support and good advice. They know that taking care of a baby can be difficult and that all parents and caregivers need support from time to time. Now here are 2 important things to remember when you make choices about who to leave your child with when you need a break, have errands to run, or need to return to work. Never leave your child alone with a person who has a history of violence or problems controlling their anger. Your baby may not be safe if that person loses their patience and then their temper. Never leave your child with someone who has been drinking or taking drugs. This will make it less likely they can care for your baby safely. Tell everyone who cares for your child about the dangers of shaking. Share with them some ways to soothe your baby. Tell them never to shake, slam, throw, hit, or yell at your child if they should become frustrated with the crying or fussiness. Give your child's caregivers permission to step away right away and calm down if they become frustrated for any reason when caring for your baby. Tell them to gently place the infant in the crib, go to another room away from the crying, and take a time out. Tell them never to pick up the baby if frustrated or angry. Tell your partner, babysitter, or childcare provider to call you for support or relief. Tell them you won't be angry with them because you know that all parents and caregivers can get frustrated from time to time and need a break. Tell them to call a parental stress line or other family support service until you return. Be sure to have those numbers handy for them also. You have learned many important facts and techniques that will help you keep your baby safe. You know that infant crying, even a lot of it, can be normal during the first few months. You have learned many easy and effective new ways to soothe your baby or child. You know that if soothing doesn't always work, it's not a reflection of your caregiving. Sometimes babies just need to cry and will, no matter what. If you become frustrated or angry, you know it's okay to step away right away and take care of yourself. You know how important it is to share this life-saving information with all those who care for your child. And so, congratulations to you! You now know the facts about infant crying, soothing, and what you can do to keep your baby safe.